So if you have knee arthritis or chronic pain, you're going to want to listen to this video because we're going to talk about knee arthritis hacks and what works fast. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. One of the things we always say is where the site of the pain is often not where the source of the problem is located. So we look at the whole body and help you put the pieces of the puzzle together. So if you've been dealing with chronic knee pain or you've been told you have knee arthritis, then you're going to want to listen to this because we have something that works really fast and getting you back to feeling great, avoiding those surgeries and those injections that don't often work. We have a thing called the shockwave, and we have radial shockwave, which is down below, and we have focus shockwave, which is above. And we're going to talk about both of those and what they do. I know this is something that works because I myself have had to use these units on myself. I'm someone that was grew up being very active, was a gymnast, working out 4 hours a day, 5 days a week, got into playing soccer, played high-level college soccer, went into semi-professional soccer. There wasn't professional back in the day. I'm aging myself a little bit, and then went on to doing marathons. And literally, while I was in college, had 2 knee surgeries. Wish I never would have had the second knee surgery, but that's a moot point now. And so now I've always had just kind of issues in this right knee. And as I've gotten into my 50s, it's definitely gotten worse. And I know going back to some of my alumni games and meeting some of my people I grew up playing soccer with, they're getting total knee replacements in their 50s. And I don't want to do that. I want to avoid that, which is why I bought this equipment. So the first piece that we got was the radial shockwave. And we'll talk a little bit about that first and what that does. Radial shockwave really helps more with the soft tissue part of it. A lot of times in the knee, things are right, the quad are right below the knee. So here's the knee, right through here. You tend to get a little bit more degenerative tissue as we get older. And when that happens, it has a lack of blood supply. Every time you try to use that muscle, it pulls on the bone, making you feel like it's very arthritic. And I can tell you when you have tissue like this, because I have tissue like this, going and getting a massage doesn't work. It works a little bit, but it doesn't fully resolve it. Trying to do exercises to strengthen it doesn't work. I've tried. Did not work until I got the radial shockwave. And so what you'll do with this is we use this device and we turn it on. And we use it on the soft tissue all around the knee, all through this quad. And when you feel it, that's tissue that's been damaged. And what it is it uses high energy acoustic waves to stimulate the cellular metabolism. It increases the blood flow in that area, accelerating the healing. I literally say it makes your tissue young again. If you just think of that, it makes your tissue young again because it brings in all the good stuff with the blood flow. And so when you do this, you'll find the areas that are damaged because you'll feel it. And those areas, when you hit those areas, you'll feel it almost wrap around to different parts of the knee. That's where you get the pain patterns, and are coming actually from that part of the tissue. So this was my first thing that we used on my knee when we got this unit. And I'm telling you, it was fantastic because after the first visit, I was like, oh my gosh, I can squat and I feel my muscle working and not my knee. Because when you feel your knee joint, then you're just doing something that's too hard for your knee. And it didn't matter what I tried, it just wasn't working until I used the radial shockwave. So then I was like, okay, I can feel some bony changes in my knee. I need to go get the focus shockwave. Very different than the radial shockwave. This actually goes a lot deeper. It's more pinpointed, and it can help heal bone. So what happens when our bones start hurting or there becomes more arthritis in the bones? It means there's a lack of blood supply in that area. And what this does is, again, it will increase that blood supply. It stimulates those growth factors and actually it stimulates our own stem cell activation in that area. And I'm telling you, again, one treatment, the knee will feel lighter. You'll be like, oh my gosh, this almost feels like young again. And I know I say this all the time, but it really does. That's what it did for my knee. And typically doing this on the knees, it's anywhere between 4 to 6 treatments. It really just depends on how many spots, how damaged it is. It just varies between those things. But you can use both of these units for an arthritic knee or a chronic knee pain and really get you back to feeling great. Now that's phase one. Phase two is once when you start feeling great, we've got to get those muscles working again. We've got to get things firing and getting them to get stronger so that your knee can be very protective. And that would be the second phase. Typically with these things, we're finding that they have way better results than stem cell injections, PRP injections. They last a lot longer than both of those together, and they are a much cheaper option to do than going down that route. So if you're interested in learning more about how this could help you, then make sure you go into our description, because we have a free resource, a free ebook on regenerative therapy and how these work with you, what conditions they can help you with, as well as our PMF technology that we have as well, and how using all those together, it's like magic. You're going to want to learn more about that. Also, you can go and sign up for our discovery visit, where you can learn a little bit more from our staff about how this could help you possibly, especially if you live in the Dallas-Fort Worth area. We are one of the only clinics that has the focused shockwave. Not many clinics in the DFW area has this technology. It's very new technology, and we're really excited to have this at our office. So if you want to learn more, go into the description to get your free resources. If you have some questions, just comment, and we'll get back to you as quickly as possible. Make sure you like this. Make sure you subscribe to our channel. We're always putting content out trying to help you understand the body better and how everything can work and how you can avoid surgery and injections and medications. It's not just about exercise. It's about doing the right exercise, and we're trying to help you understand your body so that you know what that looks like.